I'm going to be talking about service acts, about actually who's using the services from a perspective of a small community compared to the entire English-speaking community in the 03 region, Quebec City. We've developed a system which permitted us to get at some of this information. So I'll get right with it. This is a study that was funded by the CHSSN to be able to look at health services, suicide prevention, and using the geodata or the data that we've managed to get on different health service acts actually being given to health service users in the 03 region. It's a project that was financed by Health Canada as well. The team that was putting this information together, myself, who started the whole project, and there's Laura Lee Bolger, who is my assistant, Melina Papalampropoulos-Tsiridu, who is the project manager, Jean-François Richard, and then our director of the Société Capitale Nationale CLSC services at Jeffrey Hale, Mélie de Champlain. So we've got a team together that's been working on this for a couple of years, and we've developed a project. So I wanted to, first of all, look at the analysis of the administrative data that we have and some of the census data, and also look at how this could possibly develop a better service offer in the region. It provides a basis for decision makers to look at and improve on the health service offer, the active offer. And that's what we're using the geodata platform for. So I'll be introducing the geodata platform overall. We analyzed the English language health services for mental health during the pandemic period, which was interesting. It was not intended to be that way, but it happened that way. So from 2019, we have data for 2019 and for 2020 for the Société Capitale Nationale. For the entire English population, well, I was using services in English, and as well as for the entire population in that area. So we actually have a comparative basis. And we looked at the distribution at various different scales, and that's where the geography comes in, because we localize the demand and where the health service users. We want to find out where these people are and provide better services, and to be able to also provide parameters for guiding on orienting programs and policies. So we looked at different age groups and so forth, and we looked at it right down to the neighborhood level, census tract level, or the municipality level. So we were actually able to look at exactly where services were being provided, where these people lived. In other words, what context were they coming from, which permits us to get at some of other issues which might be connected within the contextual effects. In other words, what's contributing to health service use and what's contributing to mental health service use. So we looked at the geographical distribution, the proximity, and other characteristics using the geodata project. So we used the health service user data, and we had developed a protocol to be able to use this data directly from the RAMQ database using the ICLSA database. So the context was that we noticed earlier, several years ago, I had noticed actually that we were underutilizing the health information that we have that could be used for targeting minority groups and so forth to be able to get at the issues that are affecting them. So getting at that required several years of development to be able to get through and develop a protocol that would be acceptable through ethics and so forth, and also to be able to get English data, okay, or English health service user data. So the main features of our particular platform is we've got service acts for Jeffrey Hale, and we also have it for the entire population. We have it by gender, we have it by different age groups and by age overall, and we have about 28 different territorial scales or geographic scales, and scale plays a major role in this. So this is an initiative that was really pushed by Jeffrey Hale Community Services in English. We developed this protocol, we anonymized the data, the clinical data, We also looked at the context using about 380 different variables from the census to be able to say where these people are coming from. So there's a geodemographic analysis. So I'm actually doing a cluster analysis right now to be able to link that with the overall profiles of the health service users. 48,330 service acts from 2015 to 2020. And we have about over 1 million acts of service in the Société Capitale Nationale from 2019 to 2020. And we also provide a way of disseminating this information and looking at it and analyzing it just to be able to describe who and where this information is found. So here we go. There's the overall flow. We have census data providing us context. We have 13 health service acts, of which we have 4, which I'll be discussing in more detail in a few seconds. At the neighborhood level, we can actually look at the neighborhoods where these people come from, and then we model that. And we look at the resource management of, for example, home care outreach, improving the active offer in various different ways. And we also can visualize it online. So these are the different layers of information that we have at different levels of aggregation. This has direct policy implications at various different levels as well. So things that are happening at, let's say, the provincial level, or happening at the CLSA level or the CIUS level, as well as the CLSA level, or right in the neighborhood where the people are located, where they need very specific service needs. We can locate them. We can find out where that need is, and it affects policies at various different levels. So we can see that it builds up, and we have this layers of information, of different types of information interlayered, and then we have to find a model that permits us to get at that information, to get a picture, a working picture of what are the factors that are actually contributing health service use. So first of all, just briefly, this is 2016 data. I haven't updated it with the 21 data. So the population has actually increased, the English population overall. 80% of the population is still in the Montreal area. 20% is scattered in various different clusters throughout Quebec. And it's through various territorial service networks or health regions, if you want. So the maps that we produced, okay, just to look at where this population is, each particular grouping, we've divided into 5 groups called quantiles, and we see that there's a high concentration in Western Quebec, but if you look at the other angles, this is the 0-3 region, and you can see where their higher concentrations are. Even though they're roughly 2% of the population in this area, the English population does show clustering, shows geographic clustering. In other words, the demand for services is found in those particular areas, most likely. And we'll look at that demand in more precisely. And it does concord. If we change the scale and we look at it just at health region level, we can see, well, the Anglos are all pretty well on the Western Quebec, and so there's no problem in the rest of Quebec. And that's the issue that we were also attacking by looking at various different geographic scales. Because if we look at the geographic scales, as we have here by census tract and by municipality, all of a sudden we see that population is clustered in various groups, scattered in groups right across Quebec. Okay, so the issue is fairly broad, and actually the problems and issues that are related to it are amplified by the fact that the population is scattered in these groupings. So here's the structure of the population, okay? Roughly 14.8% is 65 years and over. We have various different age groupings in here. We were looking at the elderly population. We'll be looking at other age groups as we go along. And then look at the service acts that we were looking at here. Psychological services for troubled youth. This is an awful lot of work that was done in schools. There's frontline outpatient mental health services as well. And community support for people with serious mental illness. Okay, a lot of home services that are being provided right there. And then psychosocial services was a very broad category, and which is also the biggest category where services are being provided. Maybe more details would be made. Amy's nodding her head, so I think she might be able to fill us in on that. Then we have the number and proportion of total mental health procedures that were carried out, okay, by analyzing this data. And then we made a comparison of 2019 and 2020. So if we go right for it, sorry. Okay, the first thing I wanted to point out was we had 529 users in 2020, 504 in 2019. So these are health service users, okay? The number of service acts, which is number 2 that you see there, okay, was 3,600 in 2019. 2020 jumped to 6,009, okay, which is it actually almost doubled. And if we look at the prevalence rate, number of service acts per person, okay, per user, went from 7.3 for those 4 mental health service acts, from 7.3 to 11.4. So there was a huge jump, okay? And I think that's been spoken about several times, and the evidence is there. Even in this region, which is away from the major population concentration of the Anglophones, this is reflected in this particular population, and the data shows it. So there's an issue, a major issue. Now, if we start looking at the change a little bit more in detail, okay, the change was roughly 2,347 for the 4 service acts, and it was 3,227 for total service acts. We noticed previously that out of the 774 acts, okay, there are 529 those 4 mental health service acts, which means, or users. So it means that most of the users are really focused on mental health, okay? So there's an awful lot of mental health support being provided. If we look at the 13 acts, there was a 57.7% increase, okay, overall. And in 2020, well, not increase, there was the total amount. And if we look at 2020, it was 62.7%. So there was a net increase, okay? And there was also a net increase for those that are 55 and over. Okay, see number 3, it says 27.4%. So we can clearly see that a certain age group was actually using more services per person from 2019 to 2020, which coincided with the onset of the pandemic, okay, the first year of the pandemic. So, and there was it's a major jump, it's a major change. All right, there was a change also from 18.6 or 15.1% to 27.1%. Sorry, for the 15.1% is for the population that's 18 to 54. And 20.3% is the 0 to 17 age group that was using the service acts. Okay, now if we carry on with this, here we have a broad summary of the different services that are being provided. If you look at the 6560, which is a psychological service, we look at that column, you'll notice that whoops, I'm going to go back one. There was a 168% increase for women in the use of services. Okay, the percentage change. And there are large percentage changes for psychosocial services, which is the one that has the highest number of health service acts. Okay, if you notice that the other different types of health service acts, they're smaller to let's say 5910, which is services for troubled youth and their families, was 1,221 in 2019 and 1,329 in 2020. But if we look at the total for 6560, it went from 1,497 2019 to 3,619 in 2020. It was a huge jump. Okay, we see that. So mental health service acts account for a 64.1% overall increase in services, overall, okay, when we look at regardless of the gender. And the increase in each service category ranged from 8.8 to roughly 141%, which is 6560, okay, for both genders. The increase for women went from 9.3 for 5910, okay, that's the psychological services for troubled youth and their families, to 230%, which is 5940, community support for people with serious mental health needs. So what's the number of users? And if we look at that, how come we have this huge increase in users? We have a lot of different questions that are related to this, and geolocation provides us part of it. By doing a geodemographic analysis, perhaps we will be able to get at some of that. If we look at the social determinants of health, okay, what context provides some basis for us to be able to target other populations elsewhere, or possibly better explain the issues that we have at hand here in this area here of the Quebec City. Here we look at, if you look at the 1 and 2, this is a graph of 2015 to 2020 for the population that was 65 years and over. And what we see is that there's a spike at 65-60. So health service use was really focused on psychosocial services overall.
I'm just going to interrupt quickly to say
Sure.
that there's you really have like a minute, maybe 90 seconds.
Okay, thank you. Thanks, Andrew. Okay,
Sure.
so I'll wrap it up. Conclusion and next steps. How's that? Okay, we found that there are gaps that are in the services being identified, and there's also a changing dynamic because the needs are changing within the community. We clearly see that there's a changing need. Okay, and we have a knowledge base. We have information that's available. If we have it for the 03 region, we can have it elsewhere as well. Okay. And we have to develop tools that are adapted that we can actually get the feedback to be able to help better understand how come we have that particular change. So adaptation, we have to adapt to that particular change. So I'll stop right here. Okay, there's more. We have the online tools and so forth, but if you look at the PowerPoint, you'll be able to actually follow the links and able to get at it. Okay, thank you very much.